we are going to dive into the palpations of the head, neck, and face in terms of doing a concussion evaluation. So we do have a little cat right here taking a nap. Just point it out, get it out first. But first off, I'll have my patient turn around. We're going to be looking first at the base of the skull. So this is just going to be the bottom of the head down here. We have the occipital protuberance, which is that bony prominence at the back of his head. You can kind of feel up and then you'll feel that bony prominence. We have the spinosis process. So these are going to be straight in line with that spine. In relation to the spinous process, we have the transverse process, which is going to be the same level. And then we have the facet joints, which is going to be a little anterior or posteriorly above them, kind of like in that formation there. So it's spinosis, transverse, and then the facets like that. We have the mastoid process. So this is going to be found behind the ear, that little bony prominence behind the ear. So we have the bones of the skull. So first we have the temporal bone, which is going to be seen right above that arc of the ear. Right above it, higher up at that part line, is the sphenoid bone. Frontal bone is going to be up near the forehead. And then the zygomatic bone is going to be on that face near the cheeks. And it's going to form that zygomatic arch. We have the parietal bone as well. This one you're going to see kind of up in here in between those eyebrows and the ear. Next, we have the external ear. Obviously, everyone knows the external ear. The maxilla, which is going to be right in that mustache area between the nose and the mouth. And then we will get into, so the nasal bone, you're going to have the nasal cartilage on the bottom, and then the nasal bone is going to start up at the top. When we're looking at the jaw, the mandible, different parts of it, so you have the ramus coming up to here, coming up to that TMJ, the temporomandibular joint, that you can feel that movement when you open and close your jaw. So we have the ramus and then the body of the mandible coming down to the chin. We have the teeth. Lymph nodes, we know what the lymph nodes are. They're up in here in your neck. It gets swollen when you are sick. We have the hyoid bone. The hyoid bone, that's going to be up in underneath the chin, up in here, that you can feel when you swallow. And then we have the thyroid and the cricoid cartilage. The thyroid cartilage is going to be up higher than the cricoid cartilage. Cartilage is going to be down right near that Adam's apple area. We have the paranasal sinuses. So those are going to be kind of right along those zygomatic arches. We have the first three ribs, so really what we're looking at is that first rib, which is going to be right above that collarbone in that soft tissue area. You'll have them take a deep breath, and when they slowly breathe out, you can push your thumb down into that area to feel that first rib. And then we just have a few of these muscles. So the sternoid clastoid muscle is going to come from that sternum, and then it's going to come up and insert at that mastoid region, the upper traps, and then the scalenes on the side.